some of the people that came in my study came as a result of forced migration. And what people go through when they go through forced migration and traumatic uprooting, they do idealised thinking. They glorify the memories of their homeland, which might not be the last place they came from. It might be before that. Kind of a paradise. Now, idealised thinking and assimilationist thinking annoys their children very much. And it has the effect of alienating children and parents because they live in different realities. People went through transnational network thinking. They lived in 2 or 3 worlds at once. They did ordinary things across the oceans, across borders, things like weddings, birthdays, celebrations, caring for sick relatives, even flying overseas to babysit. This type of transnational contact was driven by religious activities, by family and by community, not by governments. It completely bypassed national ties and at the same time is making a big contribution to the Australian economy. It's even more common now with frequent air travel and the internet. The upside of all of this is that bonding is good. Ethnic organisations give people security, social connections, same language welfare services, culturally responsive aged care services. The downside of bonding, and this is what my research found, that after several decades, and this went on for 20 or 30 years, they run out of skills, knowledge and resources. And mainstream organisations outside them have more skills, knowledge and resources. And so what happens, the ethnic organisations develop weak external ties. They lose their bridging and reaching out skills. They feel insecure, can't relate outside, feel bad about their accents, product of monolingualism, don't even know where to go on the outside, and the second generation are not much good at it either. Fast forward to the 2000s. We've got multiculturalism, the best thing since sliced bread. Identity and sense of belonging are important again. My research found that people belong to multiple homelands. They have complementary identities, multiple identities, not shared identities. They have a sense of belonging to places, not even just countries. They might have a sense of belonging to towns or even camps. I'll tell you another story. Group of people that I interviewed every year, group of elderly people, they go to Tatura near Shepparton in country Victoria to an empty paddock with gum trees and cows. And there are a few foundations in the ground where an internment camp was. And they spent their youth in that internment camp when they were young adults. And when they got there, they said, the air is different. Now we are home. That campsite was one of their homelands. Now, I developed in my research a 3-step positive identity formation model. And you can see 3 boxes there. And the model works like this, and it works very well, and it's very simple. To express one's identity positively, one must fulfill all 3 boxes. If it is negative, if one fulfills only 2 boxes, it is negative. For example, second generation migrant might say it aloud, and one must say it aloud. He might say, I'm an Australian, son of a Muslim Kurdish person, my mother is a Christian German-speaking person, and I feel good about it. And I make a commitment to it because I do volunteer work in their migrant communities. Now, if a person only fulfills two of those boxes. For example, if a person feels really good about working in their migrant community all the time, but they don't feel so free to say it aloud out there, then they are experiencing a kind of suppressed identity. If they can say it aloud and say, yeah, I'm working in this ethnic community, I do this all the time, but they don't feel good about it, then they are also expressing a negative form of identity. And if they can say it aloud and feel good about their ethnic identity, but there is no evidence that they are making any commitment, then they are not living authentically their full identity. And a commitment could be a painting on the wall of Cyprus, of the beach of Larnaca from Aunt Bertha. It could be a framed page from the Quran on the wall, because religion and ethnicity is part of identity. The main thing about this model is that it's important, and this is important for service providers who might be able to use this in workshops or for storytelling activities, that it's DIY identity. It is self-ascribed, what the person says themselves, and people need permission to express their identity, and they need practice at it because they haven't been allowed to do it for a long time. So that brings us to bonding and bridging in aged care need help through linking. And here's what a culturally competent service provider can do with linking activities. It's the responsibility of governments and organisations to build trust with ethnic organisations, to work on partnership, reach out, provide access, information in other languages, and support. My take-home message, and it is to aged care providers, is this. Culturally responsive aged care provision is about understanding, bonding, bridging, and linking. It is about understanding how history and government policy shaped the way people think, live, and who they are. It's about spending more time on access, information, and those initial support activities, and that fits in with the active service model and person-centred approaches that we know about these days.